Good evening, I'm Trish Close.
I'm Dave DeRorange. Thanks for joining us. Doctors are concerned tonight about a sharp increase of gonorrhea cases in Southern Oregon.
News 10's Molly Trotter spoke with a local doctor to try and find the link connected to the rise in tonight's top story at 6.
Health officials are seeing more gonorrhea cases come through their doors within the last 6 months. But Dr. Cory Bergey with Providence Medford Medical Center says gonorrhea isn't the only infection that's on the rise.
Chlamydia is very common too. They usually go hand in hand with gonorrhea. When we see rises in one, we see rises in the other, and so both are kind of increasing this year.
In Jackson County, there has been about a 300% increase in gonorrhea cases this year. Josephine County, about a 270% increase, but the sexually transmitted infection spreading the most in Douglas County. They've seen about a 1,000% increase, raising a red flag among doctors, saying if you choose not to treat the disease, the consequences can be painful.
They can get bloodstream infections. They can get really severe infected joints of their bodies. So there are a lot of significant complications.
And Bergey says men are most likely the ones to get the disease.
Men are more likely to have symptoms, and we usually can identify infections in them more likely than women, who often do not have any symptoms at all, which is why these diseases are so hard to contain and get control of.
Doctors say the best way to avoid getting gonorrhea is by practicing safe sex habits. Bergey says, fortunately, gonorrhea is easy to treat with a one-time injectable medication. Covering your news, Molly Trotter, News 10.
Dr. Bergey says symptoms for gonorrhea can show up days to a month after being exposed to it.
In Jackson County, gonorrhea cases have increased from 31 to 151 cases this year. Josephine County has gone from 10 cases to 37, and cases in Douglas County rose from 2 cases to 23. You can keep track of the outbreak in your town.